Appendicitis is a medical emergency that occurs when appendix becomes blocked and inflamed. Appendicitis causes pain in right lower abdomen, and in most of the patients, the pain begins around the belly button and then moves. This is very important. Approximate 8.6% of population have appendicitis. The optimal diagnosis of acute appendicitis continues to be a challenge, as the most early and mild appendicitis is not always visualized on ultrasound. The false positive diagnosis of appendicitis may lead to unnecessary operation, which is termed negative appendicectomy. And this is very common. In this video, we will see different ultrasound appearance of the appendicitis in 4 different patients. In every patient, abdominal organs like liver, gallbladder, right kidney, pancreas, and in females, the ovary and ovarian cyst must be visualized to rule out any other pathology. In this patient, in right lower quadrant, we see thick wall bowel segment. This is cecum. There is mild adjacent free fluid. A non-compressible bowel segment seen extending from the cecum. This is coiled with one end blind loop segment. Detection of the blind loop, non-compressible, and extension up to the cecum is the most important diagnostic points of appendicitis. There is increased vascularity in the wall. Its AP diameter is 7.5 millimeter. The normal appendix AP diameter is less than 6 millimeter. The scan is done with high frequency probe for abdomen of frequency 5 to 8. Now this is the second patient. Again we see a long elongated thick wall bowel segment and one blind end is visualized. This is non-compressible, no movement seen. There is increased vascularity in the wall. As compared to previous patient, the cecum in this case is not thickened or inflamed and there is no free fluid. Its AP diameter is 6 millimeter. These are the early signs of acute appendicitis. In this third patient, again at the site of right lower quadrant above iliac vessels, we see a hypoechoic thick-walled appendix with one blind end, but at the other end there is an echogenic area inside the lumen. This is the pendolith, the fecal matter or inorganic salts inside the lumen of the appendix. Approximately 90% of cases of pendolith develops into appendicitis and needs surgery. The fourth case is a complication of appendicitis. We see that in right lower quadrant, there is collection of fluid with thick debris. The volume is approximately 75 ml. Thick wall adjacent bowel segment and cecum seen. There is increased periappendicular fat echogenicity. Inside the collection, the elongated tube-like structure, the appendix is seen. These are the complications of appendicitis, abscess formation. These are 4 different cases of appendicitis with 4 different ultrasound appearance of appendix.